It's a growing problem across the country, prescription drug misuse and abuse.
Yeah, in fact, prescription drugs are misused and abused more often than any other drug except marijuana and alcohol.
But it's not just adults. Teens are also experimenting with this dangerous trend. Harris County Public Health is working with Substance Abuse and Mental Health Service Administration on SAMHSA on a campaign targeting young adults and their parents.
And the executive director of Harris County Public Health, Dr. Umair Shah, recently stopped by to tell us about it. Take a look. Prescription drugs are something that are accessible to young people because oftentimes their parents have them at home.
Absolutely, absolutely. That's one of the biggest challenges. You know, oftentimes when, as I was, in my medical training, we would always talk about the fact that there were drugs that you would always be thinking about. These were the street drugs or illicit substances, marijuana, cocaine,
LSD,
right, all
heroin.
those things. And here you are all of a sudden realizing that we have had this growing epidemic in our country, which is oftentimes really fed by the fact that we've got doctors, the healthcare system, and patients who have a lot of access to prescription medications. They're just not being used the right way.
What are teens and young adults abusing the most? We were talking about prescription drugs. Is it like a hydrocodone or, what is it?
It's a combination. It's a combination of all the different kinds. You know, the number one is alcohol. Obviously, it's not a prescription, but alcohol still remains number one, and certainly cocaine and heroin. These are other kinds of illicit substances. But then you start to have codeine, and you start to have all, the oxycodone, OxyContin, things of that nature that you start to say, these are pain medications that people start to prescribe or get from their physicians for a certain reason. But guess what? Now they all of a sudden are being used for other reasons.
Dr. Shah, because prescription drug abuse among young people is such a big deal, and adults too, as we mentioned, Harris County Public Health has a new campaign.
That's right.
Tell us about it.
Yeah, absolutely. So we have this underage drinking and substance abuse campaign. It's really about prescription misuse, prescription, sort of the real challenge that we have around how do we get awareness to our community. And this is really a challenge because for us, this campaign started September 26th. It runs through January. And the campaign is really about getting into the community, whether we have billboards or we're in movie theaters or we're doing things like this, to really get people to understand that this is a big issue. It's a big issue throughout the country, but it's a big issue here in Houston and Harris County as well. And we want people to realize that. So everybody talks about Ebola. Everybody talks about Zika. Everybody talks about all the different things that can really harm somebody. But we want people to know that these kinds of chronic conditions, including mental health issues, substance abuse issues, prescription use, overdose, overuse, these are equally worrisome to our community. And in fact, you would be surprised that we have sometimes an incredible lack of knowledge on basic things that are really impacting our community.
Before we bring in our panel of young adults, I do want to ask, do you see most of the kids starting with, say, alcohol and then it progressively gets worse?
Absolutely. So alcohol is such a gateway drug. It remains. I mean, this is, in our society, we have such a, an incredible sort of this embracing of a culture where alcohol is accepted, and that's great as long as it's done in moderation or it's done in a way that is going to be acceptable and it doesn't get out of hand. And that's the challenge that we have, is that when things get out of hand, one individual will start from alcohol, will move to a different drug, and now move to another set of drugs, and those drugs can also get them into a lot of trouble.
To help us continue the conversation, we've actually brought in some young adults to help share their experiences. We've got Devin, Isaac, Paul, and Sarah. Welcome to Houston Life, to you four.
Thanks.
Now, Devin, I want to start with you. So when you were 14, 15, you started drinking alcohol, is that right?
I was actually 12.
12.
Wow.
Tell us about it.
So young.
Well, I mean, it started out just as a way to get out of the house and finally do something with my friends where I wasn't trapped inside of this little box. I finally got out and learned about alcohol. It became just a weekend thing. That's how it started off. And at first I thought I was moderating. I thought it was normal, but I was also only 12 years old. Now looking back, that's kind of crazy.
12 is very, very young.
Very, very young. And then moving on to Isaac, how young were you when you started? You started drinking as well too, right?
I was about 14 years old.
Wow. And then did you move on to prescription drugs and then on to others?
Yeah, so I was homeschooled. I didn't have any friends. Then I found some kids in my neighborhood who started drinking. So I found friends to hang out with. And so those were my friends, and I just slowly progressed up and up and up to even harder drugs.
So with the prescription drugs, did you just say, hey, open the medicine cabinet one day and say, I'm going to try this? Or was it a friend peer pressure?
I had some friends who were like, hey, here's some pills. I was like, what are these? They're like, oh, it doesn't matter. Just take them. They were taking them, so I thought, if they're taking them, they must be safe. So I took them too.
Wow, Sarah, was that similar to your experience? I mean, young people like your friends taking pills, they weren't even sure what they were?
Yeah, I got them in public school. So like people would bring their parents' prescriptions or their friends' prescriptions, and they would take it like during class or like outside of class. And so it was like a lot. Like my first experience was really like at school.
Wow.
Oh my! And Paul, I see you shaking your head. Was yours a similar situation where you started because of friends?
No, I broke into the cabinet and then just started taking pills.
Really?
Yeah. Well, I mean, because I had, I never was warned about any of that, or I didn't know. So I don't know what triggered my curiosity, but I found hydrocodone and took 6, and then I was off, and then that's how.
Did it ever concern you, though, that what you were taking may have a harmful effect on your body? Because 6 pills, that's, if you don't know what it is, did any one of you ever stop and think, oh my gosh, this is kind of funky?
6 pills of anything is a lot.
I didn't even know what narcotics were, so I didn't.
So there was no concern?
No.
You just sort of went for it.
Yeah.
And I want to quickly ask you, is it true that sometimes young people, they'll put prescription pills in a bowl and you go to a party and you just sort of take whatever's in the bowl, like parents would
Like
bring
candy, yeah.
Or is that a rumor? Does that stuff actually happen? Have you seen that?
Usually there's someone with a pocket full of pills, and if you know who they are, you say, hey, Johnny, here's $20, and they'll give you something.
Oh, wow.
Dr. Shaw, going from prescription drugs and also hearing so much nowadays about the synthetic drugs that people are taking, you have no idea what you're taking.
Absolutely. And I think one of the biggest challenges we have is that these synthetic drugs can oftentimes be laced with other. So there's one thing about the synthetic drug itself having some potency, but then they can be laced, and you don't know how they've been manufactured, how they've been put together. So you hear about Kush, synthetic marijuana, you start to really get concerned that people are oftentimes thinking, as you're hearing, that these are not dangerous. They're fun. They're, hey, my friends are doing it. Oh, guess what? I thought I saw my parents or some elder do this. Maybe it's okay. But that real peer group is really where drives a lot of those activities. And that's the challenge, is because they sometimes be laced with things and we're not even aware.
Dr. Shaw, so 13 years old, I understand, is the average age that young people start experimenting with any kind of drug. Now, in terms of the role parents play in this, I would imagine there are folks out there who are a bit alarmed. A lot of parents probably take the approach that, oh, not my kid, not my kid. What can parents take from this conversation?
Well, I think there are a couple of things. So first of all, I have a 7-year-old. I have a 2.5-year-old. They keep me crazy busy, and I want to keep them crazy busy too. However, the big challenge is that at some point they stop really thinking about us as being the primary way that they're getting information, and they start thinking about their peers, right? They start thinking about other kids and who are the folks that are, if you've got a good peer group and people are doing the right thing, you may be able to say, okay, everything is okay for a little bit. Don't lose your vigilance. Don't say, oh, I assume everything is fine. But then if you start to get into the kids who are doing some of these experimentations, now it starts to be an issue. And so the message to parents is, look, you should be concerned. We don't want you to just minimize this, but at the same time, there are stories. You've got 4 stories here of people who have gone through this. And I'm so proud of these. We just met right before this and talked about how much efforts that they've put forth in really coming through this in a positive way. And this program is just amazing. And that's really the message. Something can be done.
And we'd like to thank Harris County Public Health for starting this conversation in the community. If you'd like more info on drugs, substance abuse, or treatment centers, call SAMHSA's Help Hotline at 800-662-HELP or visit them online at samhsa.gov.
And we also want to thank the Palmer Drug Abuse Program for participating on our panel discussion. Those teens were so candid and frank about their experience, and we just certainly do appreciate that. We will have a link on our website to learn more about that program. We'll be right back.